let's carry on with the big story of the day. Of course, government's decision to put a temporary hold on the rollout of the Astrazeneca COVID-19 vaccine. A study has shown it's only 22% effective against the local COVID-19 variant in mild to moderate cases. We do not yet have data on how it reacts with severe cases caused by the variant that was first discovered here. But researchers are still confident it will provide some protection. Let's discuss this now with Professor Musa Moshabela, Acting Deputy Vice-Chancellor at the University of KwaZulu-Natal. Professor, thank you so much for joining us. I suppose this is just a real reminder that this virus is capable of outrunning our vaccine development, isn't it?
It's incredible, and it's just amazing to actually witness live the way that we are witnessing it. And indeed, it is teaching us a lesson also about the fact that, for a moment we thought that we could let the virus run rampage, but by so doing, then we were giving the virus the room to mutate and come up with new variants. And these are tough lessons that are hard to learn, in hindsight.
Do you think government strategy needs to change away from an attempt to get to herd or population immunity to one that focuses real time, and there's the communications challenge while there's so many unknowns? I spoke a little earlier to Dr. Karen Begg, who's a public health specialist at UCT. She says that she would still take the Astrazeneca vaccine. She thinks it's still worth rolling out because it almost primes the system. Do you agree with her on that?
Absolutely. That's what I've been saying to colleagues, that, we must not underestimate the Astrazeneca vaccine. It's disappointing against the variant, but it's still 75% efficacious against the other variants that were dominant in the first wave. We are going for the third wave. We don't know which variants are going to be dominant. We cannot assume that it will be the same variant that we have now. Nevertheless, even if it is, we believe that, especially for healthier adults, it will protect, it's likely to protect from severe disease and death. And when we do get a booster for this particular variant, then we are able to then offer a bigger protection. I'm really hoping that that is the kind of approach that government will decide on, and the advices to the minister will take.
I wonder if you could just help clear something up. You say it's likely that the Astrazeneca vaccine can help prevent severe illness and death, even with the new variant, because there is no clinical trial on humans, as far as I understand yet, to see if that is indeed the case.
So if you look at the Johnson & Johnson vaccine, same technology, it uses the same technology as the AstraZeneca vaccine. It uses the vector vaccine. And if you look at that, it has 90%, nearly 90% efficacy against severe disease and death. Now, there's enough literature to suggest that even the AstraZeneca vaccine would be able to offer protection, except it was not studied systematically for that reason.
Yes, my understanding is that different vaccines were given different things to check on. The Johnson & Johnson vaccine, we're hearing, could get to South Africa quite quickly. Of course, they haven't yet got the license, am I right?
Yes, no, they're still under perpetual approval, but it should be able to go through. There's confidence that it will. The study has a big sample size, and it's promising in terms of its results.
Would you recommend then that the rollout of the AstraZeneca vaccine crank up again? Karen Begg was saying she thinks it's going to come back into force in a few days' time. Would you agree with her, and would you then say that it should go to all health workers, or the modified approach that you were suggesting earlier, that we focus on health workers with risk factors?
So I think that for the AstraZeneca vaccine, if we are going to use it, it should go to healthcare workers who do not have comorbidities, if we have the option of Johnson & Johnson. And those with risk factors, they can get the Johnson & Johnson.
I see. But in the absence of Johnson & Johnson being available, what do we do with AstraZeneca? What would you say to government right now about what to do as of today?
I think that get a deal with Oxford AstraZeneca for a booster. Make sure that it is a done deal, and we are going to get it free if possible, or at a low cost, or just pay for courier. But whatever deal we get, we need to make sure that we have a booster for the new variant, and then we'll be able to offer the Astrazeneca vaccine.
I cannot let you go because, of course, I was going through your Twitter timeline and I noticed that you are in support of wearing 2 masks at a time. I've seen colleagues do it. I don't do it. Should we all be double masking right now? What is your view?
I'm not necessarily in support. I think that we brought the second wave in South Africa down without double masking, so we are fine.
All right. Well, thank you very much for clearing that up. That was Professor Musa Moshabela, Acting Deputy Vice-Chancellor at the University of KwaZulu-Natal.